Hello, everyone. This is Cole from the American Journal of Healthcare Strategy, and I am joined here with Deisell. Deisell, please go ahead and introduce yourself.
Hi, my name is Deisell Donahoe. I am the CEO of Dioss LLC. Just a little bit of background about myself. I have a bachelor's in statistics, master's in statistics and nutrition. I know that sounds weird, and a PhD in industrial engineering. So I have been living and breathing systems and progressive change for a very long time.
Thank you so much for joining us. We are honored to have someone of your education and experience here. One of the first questions I had in the email to you initially, and that I really want to ask, is statistically, most CEOs do not have PhDs. Most either have a bachelor's degree or an MBA. So, what led you to being the CEO of this organization? It's a very important role, and it's a unique role for someone of your skill set.
That's a really good question. I think I get asked that a lot. To be honest, I had zero intentions in my dreams and life progression to become a CEO of an organization. I was a learner, right? So I wanted to learn everything. I was the student that if I got an A on a test, but it was curved and I missed two problems, I'd still go talk to the professor because I needed to know how to do the problem I missed even if I had an A. So my kids laugh at me about that actually still because I've told them the stories. So I well, how it ended up happening is I went from undergrad, I went into investment banking, and then I wasn't really sure exactly what I wanted to do, or, to me, working for an organization was such a commitment. So, long story short, I opened up my own independent consulting firm just really to do projects. Okay. Because I wanted to be able to pick my projects. I wanted to work with people who really wanted to change. A lot of people say they want to change, but they don't really want to change. So I had that consulting company for many, many years. And I met a lot of amazing individuals. And how I came to Dioss is the board members, I used to consult for them. So they recruited me. They said they wanted someone to really drive change, who was passionate about change, and who wouldn't take no for an answer. And so that's how I ended up there. I was asked to by those that I knew.
That is impressive and also very important, kind of subtle advice there that connections are so important even down the road.
They really are. I can tell you, I don't know if my husband says it's atypical, but I still keep in touch with a lot of my college professors. I mean, I do. To me, relationships are so important. They foster our growth, our professional career, our personal lives. So I definitely encourage not to burn any bridges. You build relationships and you really try to retain those.
I think that's probably a key difference as well, not to overgeneralize, but I've worked very closely with in the past, a lot of MD PhDs, and those people tend to be a bit introverted. And so I wonder if PhDs might be more introverts and maybe you're so extroverted with these connections that that's been kind of a big boost to your career.
It's actually that's a very interesting point. I do not consider myself an extrovert. I I don't. I consider myself an introvert, but I love so it's actually really interesting. I'm not the person who's going to go to parties, who's going to go to socials, who's going to, like I'm the person who's going to stay in and read a book, and I am just full on the person who's invested in self-growth and learning. But I love people, and I love just those conversations. I feel like when you're having a conversation with someone, you can learn so much from them and they can learn so much from you. And when you really find the right people, the ones who get you, when you say something, they foster this self-growth that's pretty amazing. So I think that even though I considered myself an introvert, I still sought out those connections, those relationships. And when I found those connections, I fostered them. But there's a lot of people I definitely did not keep in touch with. But the ones that I definitely kept in touch with through the years were the ones that I really felt like there was a connection. There was a relationship there that was definitely worth fostering.
Very impressive that you've been able to do that over so many years. That's something that I'm going to have to maybe today. I'll have to reach out to one of my old professors from back at community college. So that's interesting. One thing that I really found was really fascinating about your resume is okay. We have the bachelor's in systems analysis, master's in statistics and operations. You got your master black belt, and then you get your PhD in industrial engineering. So this all follows a very linear path, makes a lot of sense. You're an expert in systems. And then all of a sudden we have a different institution, Stony Brook, Master of Science in Nutrition. What is that about? That is so interesting.
So about maybe 18 months before I enrolled into the Master's in Nutrition program, my middle son was diagnosed with celiac disease. He struggled with his health on and off pretty much maybe since he was 3 years old. Never really figured it out. We ended up at a GI specialist. Anyway, maybe when he was around 8 or 9, he was finally diagnosed as celiac disease. I tried to get advice from dietitians. I tried to get advice from the doctors. But like I explained, when I missed a problem on a test and I was young, I would go sit with the professor and I tried to understand. There was only so much advice that they could give me. And the books all had some conflicting, and it felt like nutrition was emerging science, which, it really is. So I went back and I got a master's in nutrition so I would know how to manage my son's daily lifestyle to some real depth. I didn't want to just take away gluten, but how is this relating to, how is this affecting some of his other conditions, some of his other things? How could I help him really live a life that was good and full? And so I went back to get a master's in nutrition. My girlfriends laugh at me. They said, you could have read a book, but I didn't.
That's hilarious. I love that though. That is, I think that's a beautiful motivation for doing that.
Thank you. So I just really fully need to understand the things that I'm invested in, and I wanted to find the best way. So that's how now today people are like, how in the world do you end up with this trajectory and now a master's in nutrition? So that is a question I commonly get asked, but it was my middle son. I needed to help him, and I wanted to really know how to help him.
And has it worked? Was it beneficial?
It really has. He lives a very normal life. I'll tell you something else I did that I never thought I'd do. I'd never really cooked ever. I hated cooking, but it was really hard for him to find the foods that he loved. And I started making them, and I started making everything from scratch, his breads from scratch, everything from scratch. And so he is 17 now, and he is doing very well. He is thriving. And we're just now preparing on how exactly this is all going to work when he leaves home and he goes to college. So we'll figure that out next, but he is doing very well.
Congratulations on that. That's excellent. And you'll be you'll always be able to tell him that I got this degree just for you, so I could take. I mean, that's incredible,
But
wonderful.
it's a family joke.
Yeah, that's. I mean, of course, that's excellent. And so now you started a new master's program this month, right?
Yes, my daughter actually made fun of me. She said, "Are you collecting the master's degree like Pokemon cards, sir?"
Yeah, really. That's
so,
impressive.
so I believe that masters really help you prepare for the application of something. And so I took on this position, which I love and I'm very passionate about. And I really see the coming age of computer science and artificial intelligence as a triad of three things. There is the process. You cannot automate something you don't fully, wholeheartedly understand. Then there is the data. You have to know how to analyze. You need to be able to break down the data that you're trying to present to the systems. And then you need to really be able to program, but not just program, but program efficiently and effectively. And so, in taking this role, sort of like how I got a master's in nutrition for my son, I wanted to really be able to fully manage the whole team, not just go do this, but I really wanted to fully understand what were their challenges, where would they get stuck. And I'm not saying I'm going to be a programmer and I'm going to go out and I'm going to code, but when they're stuck, I want to be able to understand their language. And so, long story short, I went back to get this master's so that I could speak the same language as our programmers, which to me, we have to work really closely with if we really want to accomplish the things that we sought out to accomplish.
I think that's excellent and goes back to why servant leadership is important and having an understanding of what's going on. We talk about that a lot in healthcare administration, where if all you've done is go to business school and now you're sitting at your desk managing clinicians, it doesn't make a lot of sense. You need to get out there and shadow at the least to be able to see what's going on. And I think that's also why doctors make such good administrators, is because they actually know what is actually going on.
Yeah, they understand that frontline. I'm passionate about frontline. I am passionate about teaching. And so I think all of these things really do come together. I do believe in servant leader. I just don't really think I'm here to tell people what to do. I'm here to solve problems with them. And I absolutely love that. And the fact that I love teaching just really fuels that so much.
Well, so tell us about what you do at Dioss, and you said in the email as well that you do a lot for frontline leaders. So can you tell me a bit about what that means and what you guys do?
Yes. So I want you to imagine the daily staff, right, and the managers in healthcare. You we say a lot, well, they're exhausted. That doesn't really begin to scratch the surface. So to give you a day of what that really looks like, they spend about 10 to 12 hours just keeping up with daily operations. Just emails and meetings and just really keeping up with the with daily operations of it. Then they have to know what's current. They have to know the new regulations that came out. And yes, there are departments that do that, but they really have to be in it. And when my director of quality comes down and tries to teach me something, they're going to teach me, but I'm not really in that moment. So life is very complicated to stay up to date and even make progress on certain projects and initiatives while at the same time surviving my daily operations. And when I was an executive in healthcare, I have to tell you, I love those people so much. And I feel for them like from the bottom of my soul. And so at Dios, we are basically building back end systems that with automation and a library of knowledge that can really help. So, for example, if I am, there is an assessment that if you go and you do an assessment and you upload your pictures could automatically get scanned and tell you what's compliant, what's not compliant. There is a chat that you can connect with a subject matter expert at any point in time. We have a broad range of subject matter experts from my consulting days that are consultants, experts in regulatory, in quality, in operations. So if you're a manager in any department in healthcare and you're about to come, you're trying to prepare for survey, you kind of feel weird asking because you should know this. There's so much of what we should know, right? We feel weird asking people, asking our peers, asking our leaders, but we're totally fine asking a computer. People will Google things that blow your mind.
Mhm.
But we feel weird asking our peers for those same things that we're willing to ask a computer. So this platform really provides not only a place for them to guide them on how to do the daily operations, but also has access to subject matter experts that can have those conversations. They can type those questions. It'll pull up articles that are related to those questions. Or if they're kind of stuck and their problem is a little unique, they can connect with a subject matter expert that will help them out. So our entire focus is on really creating this back end support that will help make life a little bit easier. You don't have to do the research to know what are your recent codes and how did they change, or wait to schedule that meeting with your quality department. They're there at your fingertips. So best practices, quality, compliance, anything you need to run that back office operation, staffing is all going to be there at your fingertips. And it's really completely geared toward providing knowledge, training, and real-time education to those frontline staff and managers.
Impressive. So that's incredibly impressive. So it's kind of like clinical decision support, up to date, Dynamed, but a lot better.
But it's really intended, and the system is going to continue to grow. It's designed to grow with the users.
Yeah.
So for example, if there's a user who asks a question about something and that's not a knowledge library, they'll get help by an expert, but it's also logged into our tickets automatically, and then that goes into queue for improvement. So now we're going to build a knowledge library about it and streamline a process so that the next person who has a similar question has access to the same information. So instead of having our subject matter experts answer the same question like 10 times, we're expanding our knowledge library with every question that we have. And so that will help make the community more and more valuable to the users.
Definitely. That's one of the issues with a lot of these systems is they're essentially just a kind of a glorified search engine in a way. They're not very intuitive in that way. When a subject matter expert responds, I have a few different questions, but when he responds, is he just talking out of his own knowledge, or does he use references? What does that look like?
Well, we have references of every regulation in healthcare
Mm,
across all states. And those are created and those they're trained with that. But there might be something that's asked that is outside of that. So these are experts. A lot of them have been surveyors in a hospital or for CMS or for Joint
mm,
Commission. So they are experts in their own right, and they have been surveyors. And so we do create some guidance, but these are not people we're training to be surveyors. These are
okay.
surveyors. And so they would be able to answer any question And then if your problem is in staffing, you're going to get connected with someone who is an expert in staffing.
Right.
So you're going to get, if you're, if you have a clinical question, you're going to get connected with someone who's a dietitian or who has a nursing background. So depending on your question, you're going to get connected with people who are experts in their own fields. And these are the same experts that help us write our content, that help us validate our content. So they have multiple purposes with us. They are frontline supporting the users while at the same time helping us write and improve and evolve the content. And that's very important because a lot of times you have people writing and creating and they've lost touch with the frontline users and frontline needs. Okay, like how many times have you seen a manager lead and when was the last time they actually went out there and saw the operations? You're like,
Mhm.
okay, do you know what it looks like? So we don't want that disconnect to happen. So these are the people that are supporting and in hearing the questions firsthand. And then we sit together and we talk about it. What are the challenges and where was it a pain point and where did the customer really get stuck and how can we eliminate? So we're all about eliminating pain points to make it easy for the users to access information because they're already, even without having to stay up to date, they're already having 10 to 12-hour long days. And then when you get home, you hope to have some time for your family, but it's really, really hard. So the easier we make it for them in our views, then the more time we give back to them in life.
Of course, definitely. And then it seems like that would be a tremendous resource, pretty much covering a lot of the major pain points from what it sounds like. How, if, don't go super in depth, you don't have to go super in depth, but how is that like built? Is it a subscription? Is it a, what does that look like?
So there's two ways that you could do it. If you're an individual seeking this help for yourself, you can subscribe. And subscription for individuals is not really overwhelming. It's $99 a
Oh,
month.
wow.
Yeah, and you get a lot, and you also get access to training materials and black belt certification and green belt certification. And a lot of these are automated modules, which is why we can keep it at a low cost point for the individual users. And then enterprises, organizations can also sign up for an enterprise for their organization, and then every employee in their organization would have access to this.
Excellent.
So,
That's really
so
good.
yeah, so there's two ways to do it. You can either be an organization who wants to provide this benefit for your employees, and so you sign up with us to do so, and then they get all that access. Or if you're an individual and you just really want that help as an individual, then there is a very low cost point.
So if I were to pay $99, does that include the expert assistance?
It does.
Oh, wow. That's really good. Nice.
It doesn't make any money. The individuals don't really make a lot of money there, but it does give us access to really providing, giving it back, right? And so a lot of the purpose there is really just to create a community content. But
Yep.
we're definitely not breaking the bank with the cost of the individual subscription.
Right. And eventually they realize that as questions get asked, they'll get used less and less.
Yeah, and our whole purpose here isn't to break the bank on an individual or a customer one time because even our prices on organizations is very modest. The objective here is really to focus on the lifetime value of that user. We want you to be a user for life. We want you to come, connect with us, build those relationships. And it was really premised on that concept that I have my relationships going back to my college professors. We want to build that relationship with you, and we want you to stay with us forever. So it's really not about, as long as we can pay our bills, then we're going to be good and we're going to continue to grow and maybe add services later on. But the main focus of our core business is really to create an affordable model that really provides a value to the users so that we can keep them for life.
Of course. And that is the best way of doing business. And that also requires that you have a quality product. So I think hearing that, people will know that you're putting quality first. So I have two kind of questions. The first one I'm going to say is, can you give us an example of how this would be used in what exact setting? Just like an example of how a person would pull this up and use it.
Okay, so let's say I am the director of food and nutrition services or environmental services, and I have access to this. Okay, so if I'm the director of food and nutrition services, I'm going to pull up this assessment. It's going to give me a list of all of the things I should be compliant with on a monthly basis in order to pass. I'm going to go ahead and go through my self assessment on this. I'm going to take pictures and upload pictures, and the system is going to want, and then I'm going to submit it. So this is how I self-assessed. Okay. And then I had some questions, something I wasn't really sure how to do. And then I went ahead and I submitted that assessment. Then a subject matter expert will validate it on the other side, review it and say, I saw that you wrote this for your action plan, but what about this or what about that? And they would give back suggestions. And then, the user can go back and update it. But here's the thing, when they're done and CMS walks in the door and they ask for their self improvement plan, they can just download that directly from the system. It would have everything that they were not compliant with. It would have action plans that were ready, that would pass regulatory compliance. They would be there, they would show. That's one example. Another example is that in the nutrition suite, this is why I gave you the food service example. There's also a nutrition suite. And what it does is when you load menus in there, it automatically validates them for regulatory compliance with CMS.
Mm.
Okay. And so if CMS were to walk in the door and you download the nutritional package, it has anything and everything CMS, CDPH, and any Department of Health will need to pass that survey from a nutritional perspective. And
Wow.
if you try to design a menu, a lot of systems out there do menus where they do take nutritionals into consideration, where they have other bells and whistles, but they don't do true regulatory validation and compliance. And ours does. And so that's why I gave you that example. So that's another way that you could definitely use it. Now, third way is, let's say that I'm building a schedule and I was just asked to cut 3 FTs. I have no idea how I'm going to do that.
Mm.
Okay. There are template schedules that I can upload as my department schedule to as a starting point. And then I'm kind of stuck. I have no idea how I'm going to reach this reduction. I'm going to press that blue button on the right hand side that's going to connect me with an expert in this field that is going to help me write that schedule with me. And that could become a Zoom call, or that could just be questions back and forth. But if the questions back and forth on chat are not enough, then that will become a Zoom or a phone conversation with that subject matter expert. So, and the reason I gave you that example is because a lot of times we're asked to do things and we don't know how to do them. So another big value of these subject matter experts is that they can really help you go through that, through that bump where you're, how am I going to figure this out? So you can really lean on them on the operation side to think of how to accomplish things that you are being asked to do at work, not necessarily sure how to do it. And you don't really want to ask someone because, again, you should know this.
Mhm. Wow, that is a lot that it can do, and I like that it's all in one place.
It's all in one place.
It's
If
really
there When you log in, there's the staffing, there's the QI, there's the
wow.
nutrition. So it just depends on when you click. It's very beautiful. And again, every time that our customers give us some feedback of how they wish it were better, then we definitely take that into consideration and we try to improve the experience for them.
That is amazing. It's so cool to hear about this new way of applying technology, and that's my final question. Where does AI come in with this?
It's a really good question. As we continue to evolve and grow, we foresee that when these leaders submit their assessment, they won't wait for a. We're actually working on an internal software robot using RPA that will basically take, and instead of our subject matter experts approving these, it'll actually be, most of them will be approved, and it'll only hold the ones that something really flags out differently, and then it'll hold it for an SME, but it'll have self validating. And why is that important? That's going to be really important because users will have immediate response, right? You submit your pictures, you submit your videos, and you will be able to see immediately where your opportunities were. And then our future, not to give too much away, is that we foresee having an actual robot on site in operations that can walk around and stop you when something is not working and something is not compliant. We talk about continuous compliance and really always staying current. But you have surveyors come in, they tell you what to do, they stop you. So we want this to be done by a robot. Why would we want this to be done by a robot, Deisell? We want this to be done by a robot because it feels less invasive, because it's just someone who goes around letting you know, oh, I noticed this, I noticed that. So these things that normally a surveyor would point out, we, with the video, the robot would be able to point it out and tell and stop. And so you're kind of really getting that just in time training directly. So that will be the future. So we are starting today with a platform, and our subject matter experts are doing a lot of that work. It will evolve into self validation and only bringing our SMEs when something flags out. And then you take it into the future, and it could be a robot that walks around. Now, why is leveraging technology important? It will be extremely important because it will not only help us deliver consistency and high quality, but it'll help us maintain low cost.
Of course, and it'll help use human capital better. Can you give me a single example? And we're going over time a little bit, but what can you give me just an example of something that robot would be able to see?
So let's say that the robot just starts and walks around and they see someone, you're in the kitchen, they see someone cutting something or prepping food without their gloves.
And it could really see that and understand. That's incredible. Wow.
And it'll have the sensors to see that.
Yeah.
And then or they see someone and just kind of like wipe their nose and go right
Yeah.
back to their food, and they can stop that. So it would really be a robot that has the ability to sense what is happening, stop, and train on demand. And again, that is our end goal, and it'll take us a minute to get there, but that is our destination. That is what we are preparing for right now.
I see why you're getting that master's in computer science, because that's impressive.
Thank you.
Wow. I'm like kind of shocked because there's a lot of after you figure out and you get it to not do false positives, like at all, you could apply that to all kinds of things.
You really can. You can have the robot walk around the hospital, identify when there's where there's no fall sign. You can really apply that and now train this robot to do many, many things.
Yeah.
And so the applications are endless, which is why, again, that is our end goal, is because our goal is to make things easier. Imagine if you could just do your job and there's someone who's correcting you and helping you and guiding you and teaching you along the way, bringing up SOPs that you can use as an example. So it takes learning on the job to a whole other level.
Wow, that is I'm excited to see where this goes as well. I
Me too.
think I'm gonna definitely be following Dioss. I'm sure our audience is gonna probably follow them as well as you. Thank you so much for coming on, Deisell. I couldn't be more appreciative of your time. This is a really exciting project you're working on.
No, thank you. Thank you for inviting me. It was my absolute pleasure.
Of course, and I hope you have a good evening. And just keep up that incredible work there. That's amazing.
I appreciate that. Thank you. You have a great evening.